where the infection has traveled to the back of the throat and has resulted in blockage of the airway. So people can stop breathing if we allow infections like that to be left untreated. So what do you do when your doctor tells you you need a root canal or an endodontic treatment? Well, the issue at hand is you certainly need treatment. As I've mentioned to you earlier, this can be a life-threatening infection, and our MD colleagues are not really able to treat this other than through antibiotic treatment in emergency rooms or in the hospital. Your ultimate treatment is basically to have the tooth taken out, which I prefer not to be the first line of treatment, but with this whole Masshealth cut situation, that may be the only treatment for our community. Our second treatment would be an endodontic treatment, a root canal treatment. What is involved is the dentist will prepare a small access in the tooth, go in, remove the infected, dead, necrotic tissue from the tooth, and then they will shape it. They'll shape the inside of the nerve chamber into a funnel shape so that we can have all the debris and everything that's stuck on the walls of the chamber completely cleaned out. And then we will replace that with a medicated material which will basically seal the tooth. And then we will place something called a post and core sometimes, and sometimes we will basically bond the rest of the tooth together and put a cap on top of the tooth or a crown. The crown is very important. I hear a lot of this, and that is patients telling me that I had the root canal treatment and it didn't work. My tooth completely fell apart. Well, the reason is once the tooth has received a root canal treatment, the tooth is weakened and it really needs a crown. A crown is sort of like an armor. It protects the tooth.
I was going to ask you, what is a crown?
It's basically a cap. It looks exactly like a tooth, and it protects the tooth, and it prevents the tooth from cracking and breaking. So if you get the root canal treatment, very often you're going to need a crown. So that's all it is. It's painless. It doesn't take forever. And it's basically my first choice in treatment, if I can, before I consider implants or...
do you do implants?
Yes, we do implants.
Do you really?
Yes. My philosophy is more of, let's try the endodontic treatment if it is a viable treatment. Of course, there's so many exceptions out there. There isn't a one-size-fit-all for everybody. And if the endodontic treatment is not something that we can consider or had failed multiple occasions, we definitely consider an implant treatment.
An implant is what?
An implant is, I would like to call it an artificial tooth. So you know how we mentioned the root of teeth?
Yes.
An implant is basically a titanium root that is placed inside the bone and allowed to heal for a couple of months. In our office, we frequently wait 3 months or beyond. And then a tooth is attached to this titanium root. And then we pretty much get a almost close to normal tooth back again. It's a fascinating procedure that works miracles.
Years ago, they pulled teeth and you had false teeth. Wasn't that what happened? Do you do false teeth?
We do false teeth. We need to understand and we need to be realistic. And one of the issues is, especially with this Masshealth, once again, I hate beating this to death.
I think you should beat it to death.
When we have a policy where your only treatment is to pull teeth, and an implant costs $3,000 to $4,000 for a single tooth, this is not a treatment that everybody can afford, and we need to understand and realize that.
Oh, I would say so.
To pull a tooth, I'd say would cost around $230 to maybe $110. To replace this tooth with an implant, we're talking $3,000 to $4,000. There's a huge gap that people need to understand, that pulling the tooth is not the end all of all problems. It's the beginning of many issues.
Because the teeth shift, don't they?
The teeth will shift. But back to the false teeth, we're talking really dentures. We're talking about partial dentures. We're talking about bridges. These are all appropriate modalities of treatment. but they all have their own compromises. And as the costs go down and as we treat our patients with less than ideal treatments, the compromises increases. So it's very important to retain teeth. It is best, of course, to be able to provide everybody with the best and the latest treatment, and in this case, either implant treatment or endodontic treatment. But
Just giving me 5 minutes.